Hello, I'm Ismail Estopa and this is my submission to NUR642 signature assignment. Here I will first give you a short synopsis of the case and why my patient decided to come and see me for counseling. I will detail the 3 different therapies that I will utilize for my patient and define each accordingly. Also, I will discuss why I picked these methods. I will also briefly describe my patient's cultural background and how I take this into consideration during treatments. The patient is a 21-year-old male who is a second-generation Filipino immigrant living in California. He is currently an undergraduate scholar in a well-known Southern California university. He is living with his family, which initially included his father, mother, and older brother. Unfortunately, last year his mother suddenly passed away. The patient feels quite close to his mother and has been grieving the sudden passing, but he also feeling enormous amounts of pressure to keep going to university and obligated to take care of his father, who is grieving as well. His older brother moved out of the house a few months before his mom passed away and is not able to help, so the patient feels trapped. A couple of months ago, the patient has started to experience panic thoughts and emotions when he is around a large crowd. Sometimes he gets overwhelmed and sleeps all day, rarely going out to feed himself. The patient also expresses fear of getting hurt or being robbed on his way to school because of being an Asian. He still goes to his classes but does not engage in any further social activity. Aside from the anxiety, the patient is also feeling angry at his brothers for abandoning their family. He expresses his fear to move out of the apartment for his own mental health and knows that his father will understand this decision, but he is crippled with guilt of leaving him at this time. This is the reason patient decided to go to counseling to talk through his feelings and decisions and to cope with the situation. To manage my patient's generalized anxiety disorder, I'm employing 3 psychotherapeutic modalities to introduce to the patient. According to Judith Beck, training clients with GAD to detect both incipient internal and external anxiety can help them identify and apply coping skills that target both psychic and somatic symptoms of their disorder. For this patient, I will utilize CBT, specifically journaling, DBT using mindfulness, and acceptance and commitment therapy. For the second segment, I will ask my patient to journal the negative thoughts that occur to him. Journaling is an important tool in CBT since it allows the patient to identify and take note of the triggers that create feelings of anxiety. Further, it also helps the patient realize how negative thoughts can occur from these triggers and ultimately separate these narratives from his reality. The way the patient is empowered about his own feelings of anxiety and is able to keep track of his own progress. The next therapy I will use is DBT, specifically mindfulness. Aside from starting each session in this video with mindfulness exercise, I will guide the patient to comprehend the mindfulness skills he has to do throughout the day. The session will be concrete and behaviorally specific, beginning with observation, describing, participating, and most importantly, non-judgmental stance of his thoughts. Finally, ACT or acceptance and commitment therapy will be employed. With this being an action-oriented approach to psychotherapy, I will encourage my client to stop avoiding, denying, and struggling with these inner emotions and accept these emotions as natural and appropriate responses that should not prevent him from making hard decisions or moving on with his life. In the 4th segment, I will show the client how to cognitively diffuse to change the way he reacts to negative thoughts or narratives so that he can observe a thought without judgment and will be able to label the automatic response he has. I think it is important to use the different therapeutic techniques rather than just one to assist the patient in the natural progression of a response to therapy. The patient needs to identify first his internal and external worries that start his anxiety and then continue identifying his responses to them through journaling. Then the mindfulness technique will help his long-term and short-term response to handling the stressful and worrying moments in his present-day life so that he can cope better with these events. This assessment is based on suggestion by Beck and Sadok et al., who advocate for therapy as an ever-evolving formulation of the patient's problems and providing methods to cope. The collaboration and active participation between therapist and patient is critical in seeing the patient succeed, so I believe these 3 modalities will allow the patient to be an active participant in his own care and empower him to take charge of his own healing. I share the same Filipino culture with my patient, which is based on close family ties. I understand the patient's feeling of responsibility and guilt about moving out with his father's apartment since he is also grieving for the sudden loss of his wife. There's also the concept of utang na loob or owing someone that Filipino children are embedded with, which means that we have to give back and take care of our parents during their old age. So the patient's feelings of anger toward his brother is also cultural because he feels that he should be obligated to take care of their father too. Yet the patient also has conflicting feelings about the need to move out of the apartment for his own mental health. His plan is to move into university housing, which is not actually far from his father, and still intend to take care of him while he has his own space to heal from his mother passing. I believe some parts of the session will be met with some resistance. Therapy and counseling are not common treatment for Filipinos, even Filipino Americans. My cultures like to keep our problems to ourselves already in the family. So I think that will be the most challenging barrier of our sessions. But we'll employ what Beck suggests, which is to establish a therapeutic relationship with the patient all throughout the three sessions so that we establish trust and openness with each other. My expectations are that the patient will be able to incorporate the modalities into his own real-life experiences and be able to handle his anxious thoughts better. The goal is to ensure that he practices these coping techniques on his own and responds to his intrinsic and external worries and is able to function and thrive in stressful environment. Hi, welcome to our session. How are you doing today?
I'm doing well. How about you?
I'm doing great. Before we begin, I would like to ask you if you do understand and give consent for this session to be video and audio tape, then submitted to Brandman University.
Yes, I do understand and give consent.
Perfect. Thank you for that. How are you feeling today? Do you want to start with a mindfulness exercise?
Yes, please.
Okay. First, for this mindfulness exercise for 3 minutes, we are just going to imagine that we are walking by the river. Close your eyes, rest your back on the chair, and your feet flat on the ground. Breathe in carefully and breathe out softly. Breathe in through your nose and breathe out through your mouth. Imagine that you are walking by a big calm river. There is no one else there except you. As you walk, concentrate on the way the water moves. Keep breathing in with your nose and out through your mouth, concentrating on the river, its sound, its movements, its peace and calm. If there are any thoughts that come to you, do not shut them down. Be curious about them. Then let them flow into the river. You're letting go of these thoughts and concentrating on your breathing in and out. I will keep track of time so you just focus on the river in its calmness. Now you're stopping your walk and slowly move your toes, your feet, your fingers, hands, and gently open your eyes. How was that mindfulness exercise for you?
It was okay. There are some thoughts that distracted me. I tried to push them into the river, and whenever they came back up, I started concentrating on my breath.
Are you comfortable sharing these thoughts with me?
Yes, it is the same thought over and over again. I really want to tell my dad that I want to move out next month, but every time I try to tell him, I get so scared.
What do you think you are scared of?
I'm scared of him getting angry at me. I'm frightened that he might shut down and just not talk to me. I don't know.
Is that reaction you think your dad had before?
Not really. He's quite understanding actually. He's very encouraging. It's just that I know he's sad right now because my mom is not here anymore. He just watches TV all the time, rarely says anything. Maybe because he's so quiet that I'm so more scared.
Okay, let's see. If I were your dad and I'm in a good mood and you think you can tell me what you are thinking, how will you tell me? Describe the most ideal situation that will make you comfortable enough to tell your dad and want him about.
Yeah, so ideal situation is I sit down with him. We do this sometimes. Then he asks me about my day and I tell him that I want to move out of the university housing, but I will visit him every day. But I will be also honest with him and let him know that I'm struggling right now and need to be somewhere else so I can focus and finish my degree.
That sounded really good to me. Where do you think will be your dad's what do you think will be your dad's reaction?
I think he will somewhat sad, but he will agree it's because he knows it's the best for me.
I understand that is a big step for you to talk to your dad about moving out. You're also expressing feelings of anxiety about this. But what do you think will happen if you let these feelings, fear, anxiety, and panic throw out into the river?
then I may be able to talk to Dad, but I'm not sure if I could relax enough to do that.
Understandable. For your homework this session, I want you to write down in your journal all the thoughts you have talked about talking to your dad and moving out. What do you think will your dad's reaction will be if you told him? Put in one corner, and then the other, how do you think would you feel after telling him?
Okay, I can do that.
Good. Then we can discuss these thoughts in our next session, 3 weeks from now. Do you have any question?
Yeah. What if I have other thoughts that are not related to questions that you ask? Do I also write them down?
Yes, of course. You can keep journaling your thoughts and then we can discuss them as well.
Thank you so much.
You're welcome. I look forward to chatting with you to our next session. Hi, how are you today?
I'm doing well. I did more journaling the last couple of weeks.
That's great. And I'm excited to talk about these thoughts you wrote down. Do you want to start with mindfulness exercise first?
Yes, please.
Okay, for this session, I want you to close your eyes, lay your feet flat on the ground, and then put your fingertips together. Concentrate on the sensation of your fingertips against each other, and keep breathing in through your nose and out through your mouth. Then we also silently count 1 to 10, and then over again when it's done. Just concentrating on your fingertips. If a thought comes up, just notice it, observe the thought, do not label it or judge it. Just say hello, thought, and then let it go away. Concentrate back on your fingers and on your breathing or counting. We'll do this for 1 minute, and I will keep track of time so you can concentrate. Okay, start to wiggle your toes, then your fingertips, and then you may gently open your eyes. How was that mindfulness exercise for you?
Well, it helped me get rid of some thought that keep pushing in. It was hard not to judge the thought, but I did my best. Also, I have been journaling a lot, so I think that helped a bit.
Okay, that's wonderful to hear. Do you want to talk about the thought that came up during that session?
Yes, absolutely. The thought of telling Dad that I want to move out and then my brother is there, and my thoughts are angry, scared, frustrated, annoyed, guilty, sad, and missing Mom.
Okay, anything else?
The thought about how relieved I will be when I move out, like happy, fresh start, coping new beginnings, breathing. Dinner with Dad will be fun, giving my brother more responsibility, I guess.
Okay, good. Thank you for sharing that. Where are the thoughts coming from?
The thought of my dad losing his son, I wonder though if he actually needs me. Lately, he has been encouraging me to go out with my friends. I also wouldn't really want to go out with my friends because they all look they all look at me like I went through a tragedy or something, which is true. I did go through a tragedy. However, I don't want them to pity on me. I get anxious and wish to go home whenever I go out with my friends. I do not want to disappoint them or my dad.
All right, thank you. I hear a couple of thoughts in what you have said. First, I hear that you feel like you're feeling relieved when you think about moving out. Second, I hear that you're frustrated with the situation at home and that your dad is actually encouraging you to move out. Finally, I hear that you do not want to disappoint anyone. Is that right?
Yes, that is true. Sometimes everyone looks at me like I am someone they need to pity. You know, I don't want them to look at me like that.
Of course, you should not be looked like that. What do you think they may be thinking of when they look at you with pity?
That I'm weak? I'm not good enough?
Do you think you're weak?
No, I'm not.
Okay. What about your dad? What do you think he thinks of you?
I think he admires me. He always tells me he's proud of my scholarship, that what I'm doing in school. He tells me that I should go and enjoy university because that's what my mom wanted.
Do you think he will ever think you're not good enough?
To be honest, no, I don't think so. He always tells me how he's proud of me and that he wanted me to finish school.
Okay. What about your friends? Do you think they'll ever think you're not good enough that you're disappointing to them?
To be honest, no too, because they're still my friends. Even if I haven't been going out with them a lot. Many of them have been reaching out almost every day or texting me and telling me that they're just there if ever I need them.
So where do you think these thoughts are coming from?
I don't know. Yeah, I don't know.
This is the wonderful thing about observing our thoughts. We learn our own ways of thinking, right? Those thoughts are there. Yes, they are just thoughts. That's what they are. They are not in the present moment happening. They are only in your head, kind of circulating around. So when this kind of thoughts that are not related to what is happening to you in the moment pop up, just say hello thought and then let it go. If they persist, maybe you can do what we did in the mindfulness exercise and just count 1 to 10, breathing in and out until the thoughts quiet down. If they keep on persisting, try to keep a small notebook with you so you can journal them away. Observe the thought through your journaling. Do you like journaling?
I actually do a lot. I find that it helps me calm down, and at the end of the day, I've been able to go sleep quicker, which make me wake up better.
Fantastic. I'm glad this is helping you. Continue journaling until our next session or more if you want. But also as homework, try to meditate every day or every other day, like what we do at least for 5 minutes. Just to set your day in the right direction and keep practicing observing these thoughts and saying hello thought and then letting them drift away without labeling them or judging them. They're all thoughts, nothing more, nothing less. They are in the present moment. They are not in the present moment. We can come back and discuss more about it next session, okay?
Yes, thank you so much.
You're welcome. Hey, it's nice to see you today. How are you doing today?
Very good. How about you?
Good to hear. I'm doing well. How do you feel about starting with the mindfulness exercise first?
Yes, as always.
Great. For this mindfulness exercise, I would like you to just focus on your breath. Count 1 to 10 and then back again, mindfully breathing in and out as you go. If you miss the count, that's okay, as long as you maintain counting 1 to 10. In case any thoughts pop up, just notice them and say hello thought and then continue counting. You may close your eyes, set your feet flat on the ground and put your hands on your lap or wherever is comfortable. Keep breathing in and out and then counting 1 to 10. I will keep track of time so that you do not have to. Okay, slowly, gently finish your counting. Wiggle your fingers and then toes and open your eyes. How did that go for you?
It went okay, I think. I was distracted at times, but counting helps a lot. It keeps me focused and grounded.
Good to hear. Is there any thought you would like to talk about?
Yeah, so my friends has a party coming up. You know, everything went well when I told my dad about applying for university housing. He loved the idea, and since it is close to our apartment, I can have daily dinners with him. My friends get excited too and wants to throw me a moving out party. I don't know how to feel about it, but I also don't want to say no.
Okay, do you want to say no to the party?
Not really. I wanted to try and go to the party. I'm actually sometimes looking forward to it. I wrote it in my journal that I'm excited, scared, shy about the party. I'm not sure. What if I get overwhelmed and just disappear from the party?
Do you think that will happen? Well, what do you think will make that happen?
I think if someone asks me about my mom, I might just go away and disappear even if it's a party for me.
Okay, imagine that you are getting ready for the party. What do you want to do to make sure you're prepared for the party?
Well, I want to look good. I have some wine to bring.
Good. What imagining yourself in the party? What do you think realistically could happen?
It'll be intimate group. Maybe it's just 7 people. Just my closest friends.
Okay, let's make a note about that. What else is happening in the party?
Board games. I used to love playing board games, and I think that will distract people from asking me about mom.
Is there anyone there who will actually instigate that question?
I don't know, but if someone will start the topic, then I can tell them that I feel about the loss.
What do you think is happening with you then?
I think if I will answer them without getting anxious, then I'm embracing my automatic thoughts and feelings rather than pushing them away, running from them, or feeling guilty about them.
Yeah, that's good. A big part in managing your anxiety is acceptance. Acceptance of our limits, acceptance of the things that we cannot fix, acceptance that we cannot do our best in certain situations. So let's set some goals here. What is your goal for the party?
I want to write down my thoughts about it, prepare with meditation exercise, and then during the event, make sure to go back to my breath. If I feel myself becoming anxious with automatic thoughts, just breathe in and out. My goal is to be present in the moment and just enjoy.
That's amazing. Before you know it, you will be incorporating these relaxation techniques in your life like a clockwork. And that's the goal of therapy here, that use these coping techniques so that you're able to function and do the things you love.
Absolutely.
No worries. I look forward to hearing about the party and your thoughts in your journal for the next session. Goodbye for now.
Goodbye, thanks.
Different therapeutic modalities used for the 3 session with the patient work really well together to help the patients manage his own feelings of anxiety and overwhelm. At the beginning of each session, I made sure to incorporate a mindfulness exercise to ensure that the relaxation technique is there and that the patient is familiar with it. The journaling seems to be the patient's favorite activity since he likes to write and document his thoughts. This way, he is also able to separate the automatic thoughts from what's the real and the present. I think overall the sessions went really well. As expected, there was a bit of hesitation from the patient, especially during the first segment, but that is expected as he is still being introduced to the therapist. And all, I believe, being able to discuss the patient's thoughts openly without judgment and with cultural competency really helped his progress.